Sometimes it helps to talk with someone who's walked in your shoes, and that goes for individuals struggling with mental health issues.
Peer support can help someone navigate the complexities of a behavioral health system. News 4 Investigates introduces us to a local agency doing that work inside the region's biggest and busiest psychiatric emergency room. Luke Moretti reports.
There is a great demand.
Melinda Dubois
We're in a crisis.
is Executive Director of Mental Health Advocates of Western New York.
And there's a lot of people with a lot of needs.
She's talking about the mental health care challenges in the region.
And when I think about the issue, I think about it as a community-wide, system-wide problem.
She says Mental Health Advocates is doing its part to provide support and hope to struggling individuals. One example is a new peer bridger concept at Erie County Medical Center's Comprehensive Psychiatric Emergency Program, known as CPEP.
So we have adult peers and youth peer advocates and family peer advocates that work closely with CPEP. These advocates are in the hospital, right in CPEP, providing resources and support.
She says right now there are 4 youth peer advocates and 1 adult peer advocate working in the hospital.
We're hiring more so that we can provide around-the-clock coverage.
These are folks who have navigated the same choppy waters, bringing to the table their own experiences.
They're individuals that know the system.
Ronald Scholerman is ECMC's Vice President of Behavioral Health Services. He tells News 4 Investigates that the peer bridger concept is a welcome addition.
They have a lived experience, so they're regularly part of our visitation process, engaging with the families in the hallway, and we're working on a curriculum for them in 2024.
As News 4 Investigates has been reporting, ECMC is a safety net hospital, open 24/7, with a busy psychiatric emergency room and behavioral health campus. At times, the hospital gets slammed with patients, and that can have a ripple effect on staffing, wait times, and available inpatient beds. It's ground zero for a lot of people in crisis, even cases that don't necessarily require an emergency room level of care. Erie County Mental Health Commissioner Mark O'Brien is hoping to change that.
We want to have a mental health response in the community with the philosophy of, if you're in crisis, it should be, who do I call, who can come, and where do I go? Really kind of in that order. And so we don't want you to have to go to CPEP if you don't need to go to CPEP.
The resources are out there, with more coming. Options that don't look or feel like an emergency room setting. Outpatient services, living room models, hotlines to speak with someone. There's even a smartphone app called Erie Path.
And that's what's in play right now. Are we there? No, but we have made substantial progress.
The challenge is connecting them in a way that works for patients, providers, and the big hospital on Grider Street in Buffalo.
So there's a lot of things in the works right now. A lot of people are trying to address this issue together.
It can be done?
Yes, definitely, it can be done.
There's light at the end of the tunnel here?
Yeah,
so
I think
bringing everything together.
Yes, I think the real solution to this issue is a coordinated effort. Educating our community, understanding the resources that we have, really allocating those resources across the community appropriately, and making sure that people get the help that they need.
In the weeks and months ahead, News 4 Investigates will continue to examine the mental health care system in Western New York. In the meantime, we have posted links to available resources on our website, WIVB.com. Luke Moretti, News 4.